Hello, welcome back. I'm Dr. Mark, and today we are going to review the 7 main factors that can lead a patient to have diabetes. This is what we call a risk factor, and we identify this on our patients to prevent the disease. So we are going to look at the 7 most important. First of all, there are some people that just are born with bad genes, talking about diabetes. And the easiest way to know what's the genetic charge that a person has, it's the family history. So if a person has a family member, a very close relative, like a brother, a father, a son, whatever, with diabetes mellitus type 2, the risk that that patient also develops the disease is also very high, because we are assuming that some of those genes will also be in our patient. Obviously, we cannot change the genes which we are born with, so we have to know this risk factor to prevent really strongly the other risk factors. Being overweight is the second risk factor. We've talked about in previous videos, but the adipose tissue, the fatty tissue in our body, when we have too much energy stored, it starts to secrete some hormones that block the effect of insulin. And then it doesn't matter how much insulin we have, it will not work because of this other hormone. That's also why one of the key measurements in a patient with diabetes is the abdominal circumference, because the greater the abdominal circumference, the greater the abdominal fat we have, and the greater the abdominal fat, it's the greater insulin resistance that we'll find in that patient. And that's why we have to keep our abdomen below 37 inches for men and 35 inches approximately for women in our medical checkups, or 94 centimeters and 88 centimeters. As we age, we also have other changes in our muscles, in our body fat, and in our activities. So people 45 years or older are at the highest risk of diabetes mellitus type 2. It doesn't mean it can't be found in younger patients. In fact, even children can develop diabetes mellitus type 2 if they have enough risk factors and enough abdominal fat, but definitely most cases that we will find will be in patients over 45 years old. Since this is another risk factor we cannot change, we cannot just become younger with the years, then we have to also know about this risk factor, and from 45 years onwards, and even a little bit before, we have to be extremely careful with our other risk factors, diminish them, and then we will not develop diabetes mellitus type 2. Our muscles are one of the main organs that store glucose and also that help fight against insulin resistance. So keeping our muscles well trained is a game changer in diabetic treatment. We should at least exercise for 150 minutes per week, and this has to be a moderately intense exercise. So we need to keep our heart rate above 100 beats per minute. It has to be a somewhat demanding exercise for it to protect us against diabetes. Insulin resistance is another important risk factor, and here of course we are talking about the other diseases, not diabetes, that cause insulin resistance. So we can go from pre-diabetes, that it's not a disease per se, but it's like a step before having diabetes mellitus type 2. There is already insulin resistance in those patients, but also we have other non-related diseases. For example, polycystic ovary syndrome is a disease characterized by high levels of androgens and insulin resistance. We may also find non-alcoholic fatty liver disease. It's the liver is filled with fat, and this is also a sign of insulin resistance independent of diabetes mellitus type 2. And we also have patients that during pregnancy develop diabetes, and then after having the baby it disappears. That disappearance of the diabetes doesn't mean that that patient does not have insulin resistance. All of the diseases I previously mentioned are characteristically associated with insulin resistance, and thus when a patient presents one of them, we have to be very careful that onwards on his or her life they might develop diabetes. Some drugs can also increase our risk of diabetes or make the control of our diabetes more difficult. Some of the classical drugs that we can find here are steroids, used of course for inflammatory diseases, including autoimmune disorders. We also find relatively common drugs, like for example statins or some diuretics. Now here I don't want to say that we have to suspend those drugs just because they increase the risk of diabetes later on in our life, or that it make the control of the diseases harder, but we have to be very conscious that if we need to take that drug for our health, then our risk is slightly higher, and once again we have to really prevent the other risk factors that we can take out of our life. In other examples, we have things like antipsychotics, like some other drugs that work on our brain. So we have to know these drugs, and of course we will very soon have a video about these drugs that increase the risk of diabetes. Finally, some hormones can also interact with insulin and cause insulin resistance. We already mentioned one, androgens, very high in patients with polycystic ovary syndrome. But there are also other diseases. There are some diseases that cause a great increase in the concentration of the stress hormone cortisol. We have diseases of the thyroid gland, where the levels of thyroid gland can also affect the levels of insulin and its activity. And finally, growth hormone, when it's hypersecreted, or prolactin, for example, can also lead to insulin resistance. So in a patient with these hormonal diseases, it's highly likely that we will find also diabetes mellitus type 2. And to manage diabetes, we have to control the hormone, the other hormone that is affected, and of course at the same time measure and control the imbalance in glucose. And those are the 7 main signs that you'll have diabetes. Of course, the purpose of this video once again is that you know them and that we can prevent them, that you know that the risk is higher, maybe you, in someone in your family. You can talk to your physician and decide what is the best course of action to prevent the appearance of diabetes, or if you already have the disease, to protect your health, your quality of life, and have simply a happier life. That's all for today's video. Thank you very much for watching up until this point. And as always, help us change the world, share the information.